DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, thanks for joining me today on DocTalk. My guest, Dr. Vickie Cooper here at Iowa State University's Veterinary Diagnostic and Production Animal Medicine Department, when we're going to talk about bovine viral diarrhea, or BVD. It's something that has a huge implication on the health of the U.S. cow herd, and we're going to talk about different things and strategies to find out if it is having an impact on your herd and how you can prevent it from causing problems.
Kim Mannering with Hardy Insurance. Today we will talk about umbrella coverage. Did you know that if you're held liable in any type of accident, the judgment can claim your assets? Please give me a call so we can discuss. 316-945-6733.
Welcome to the Western Kansas Wildlife Travel Center, right here in my hometown of Oakley, Kansas. We're the front door of Western Kansas, located on 3 main highways, I-70, US 83, and US 40. And all those roads lead to history, beautiful scenery, and adventure, no matter which direction you go. We now have an IHOP. That brand that you've trusted up and down the road in all your travels is staffed with local folks, real people, just like you and me, and we're waiting on you to join us. So for fun, adventure, fuel up, fuel your body, and let's have some fun.
Kansas Corn reminds you that E15 fuel is the right choice for every kind of driver. For the car enthusiast, E15 has higher octane. For the thrifty driver, E15 is priced lower than regular unleaded. For the nature lover, E15 provides cleaner air. For the shopper who buys local, E15 has more ethanol from our Kansas corn farms. Choose E15 for a higher octane, lower price, cleaner American fuel. Message from the Kansas Corn Commission. Learn more at kscorn.com.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. Dr. Dan Thompson here with Dr. Vickie Cooper. We're at Iowa State University's College of Veterinary Medicine, where Dr. Cooper is a clinical professor and she is a member of the Veterinary Diagnostic and Production Animal Medicine Department.
True.
And she sees a lot of cases. She works with a lot of producers, veterinarians, very, very well known in the beef industry, somebody that we all use as a resource, and thank you for taking the time out.
Happy to be here.
It's great to have you on the show, and you know, we're going to talk about bovine viral diarrhea, BVD, and you've spent a lot of time looking at BVD.
I've spent almost 30 years looking at BVD.
Yeah,
so.
And so let's just start out with the background on BVD. If a producer came up and said, you know, I really don't know much about BVD, what would be our elevator speech to them?
So BVD is a component of multiple issues in cattle. One component is abortions, right? If an animal or a pregnant animal is exposed to BVD in the first 4 months of her gestation, she has the potential to abort, have a calf with congenital defects, or have what we call a persistently infected calf. So that's one component of BVD. Another component of BVD is it can cause enteric disease.
Yep.
Right? In conjunction with a number of other agents, it will make that worse. And it's also a component of bovine respiratory disease complex.
Yep, and so, we hear about this persistently infected calf. Everybody says Bvd PI, it's like it's something that is so common, but how does that happen?
So that happens when a pregnant animal is infected with a non-cytopathic strain of BVD in the first 4 months of gestation.
Okay.
And if that calf survives having been infected and she gives birth to it, it will be a persistently infected calf.
And that means persistently infected means forever?
Means forever. And those animals typically shed a lot of BVD in their nasal secretions, feces, urine. So they're kind of a little BVD factory.
You bet. And BVD can be pretty transmissible from animal to animal.
Yes, very. And so the biggest concern is obviously if you have a persistently infected calf and you don't know about it, and he's out with the other pregnant or out with the herd during bull season, then that animal's going to shed virus to whoever he or she comes within proximity to, and can cause additional persistently infected calves.
Sure, it can cause abortions and
just reproductive loss, failure of conception.
You bet. You bet. And then when we get them to the feed yard, that calf can cause the immunosuppression of all its pens.
Exactly, right. So just picture a calf with a little cloud of BVD hovering around him, right? And he's disseminating it to everybody else that's in the pen.
Yeah, looks like pig pen off.
It looks like pig pen on peanuts, yeah.
It's not dust or dirt, it's BVD virus.
Right.
Yeah, well, that's great. Let's take a break. When we come back, we're going to talk more about bovine viral diarrhea. We're going to talk about different things that you should be looking for as a producer, things that you can be doing to work with your veterinarian, and much more. We have Dr. Vickie Cooper here from Iowa State University's College of Veterinary Medicine. We'll see you here after these messages. Thanks for joining me today for Boehringer Ingelheim's Cattle First. When we start to think about labels that are on bottles of antibiotics, it's extremely important that we follow them. The first thing that's on the label, what species is this indicated for? So it might be for cattle, for horses, for dogs, or cats. Once we understand the species that these products are labeled for, what's the indication? Bovine respiratory disease. Could it be for foot rot? There's a list of species, indications. After that, what's the dosage, what's the route of administration, and then what's the withdrawal time, or the time in which it's safe to take an animal to slaughter from the time in which the animal was last treated until that animal was slaughtered. So, species, indication, dosage, route of administration, withdrawal. All of these are important components on a label, so make sure that you follow them and use antibiotics judiciously. Boehringer Ingelheim's Cattle First.
SureCrop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well on their planting systems and what they're doing. SureCrop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but yet we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we're glad to answer and work with you.
You don't have to be a farmer or rancher to become a Kansas Farm Bureau member. Anyone can join. As a member, you'll get discounts on things like hotels and entertainment, health and wellness services, cell phone plans, and more. You'll also strengthen the lives of your fellow Kansans and help build strong, prosperous communities through agriculture advocacy and education. Join us today. Visit kfb.org/join to learn more.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Vickie Cooper. We're at Iowa State University's College of Veterinary Medicine. I work at K-State, graduated vet school from Iowa State. You work at Iowa State, graduated vet school at K-State.
Right.
One of us probably should have wore purple.
Possibly, yes.
Or both.
Or both of us.
But
Maybe both of us.
We're both in red because we're here. When we'll invite you down, when you're in Manhattan, we'll both wear purple.
I'll wear my Willie t-shirt.
There you go. All right, so you see a lot of cases, and we have a lot of cases that are sent in. What are some of the things that we're doing diagnostically now for bovine viral diarrhea?
So there's a lot of different options. Probably the gold standard for a number of years has been immunohistochemistry, which stains a fixed ear notch, and if it's red, the calf's positive. If it's not red, the calf's negative.
Yep. And the reason why you can take a chunk of ear is because that BVD virus in a persistently infected calf
is everywhere.
Every cell of the body.
Every cell of the body.
Unbelievable. So that's the gold standard. What are some other types of tests?
So there's other tests that are just as good or very good. One's the BVD ELISA. You can use it on serum or an ear notch. We usually recommend the ELISA on ear notches for animals that are younger. Once they go over 6 months of age or so, you can use a serum sample.
Okay.
We also have Bvd Pcr, which is a very sensitive detection test, and we actually use that on both pooled ear notches that are fresh or pooled serum samples or tissue samples from a dead calf.
Yeah, and we've been doing a lot more of that in the animals that we send in. You just get that PCR type panel that picks up everything, and it's quick too.
It's quick. So for us, for instance, a calf that has pneumonia that your veterinarian sends a sample into, the same day we get the sample, you'll have a test result for our PCR. So same day turnaround is pretty nice.
So when people, obviously we want people to work with their veterinarian. However, what are some of the times or opportunities for testing, or maybe not testing, or in your herd that we see? So
that really is, I really encourage people to sit down with their veterinarian and kind of assess what the risk of having BVD is before they decide to spend money on diagnostic testing.
Right.
Oftentimes, if they are aware that they have a persistently infected calf or have had a persistently infected calf, we actually recommend that they test those calves when they hit the ground, when they're putting their tag in, giving them their vaccines, whatever. Go ahead and take that ear notch. You can save up a group of them to send in to be tested, but it works out very well for most people to just test them as they're processing them.
Gotcha.
We have other individuals that is not as handy for them, so they will test them at weaning, which is not as advantageous.
And so if you do it on the calves, you also need to remember to do anything that was open.
Anything that was open, bulls, absolutely.
Yep. Well, folks, work with your local veterinarian, work with people like Dr. Cooper to assess your situation, determine what type of test, when to test, things to that nature. When we come back, we'll talk a little bit about biosecurity and vaccination here with Dr. Vickie Cooper at Iowa State University.
Join us for the 15th annual Fall Bull Sale at Gardner Angus Ranch, Monday, September 30th at 9 a.m., featuring approximately 450 registered bulls, 160 registered females, including 35 cows and 125 heifers, and 300 bred commercial females. These are elite herd sire prospects and rank in the top percentiles of the Angus breed for calving ease, growth, and end product merit. Catalog will be available at GardnerAngus.com. Register for online bidding at liveauction.tv. It's business as usual, producing value-added seed stock that provides opportunities for profitability regardless of our customers' chosen marketing endpoint. See you in September at the ranch.
When it comes to stopping horn flies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin VetCaps from AgriLabs.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Vickie Cooper, who is a clinical professor here at Iowa State University's College of Veterinary Medicine within the Veterinary Diagnostic and Production Animal Medicine Department. And Dr. Cooper, you know, when we're talking about BVD and testing, but what are some of the things producers can do as far as biosecurity, vaccination, different things to that nature?
Well, I think it's important to remember that you need to have a biosecurity, a plan in place before you start testing, right? Because if you're going to test but you don't have a plan, you've really wasted your diagnostic dollar.
Right.
So that's why it's so important to get with your veterinarian and just make a plan, right? Evaluate your vaccination program. See if there's changes you need to make in your vaccination program. Evaluate how you bring new animals in. Right. My favorite story is it's taken me 15 years to convince my husband not to buy a cow and bring her straight home and put her in with the rest of the cows.
Right.
Right. Things like that, right? Because if you don't have those kind of situations in place, how much should you even test, right? Because you're just going to continually potentially re-expose your herd to a persistently infected animal. So.
And jumping forward, you know, vaccines can be pretty protective and
Very much so.
And help with the prevention of the fetal infections and cow and bull and even in the feedlot. So thoughts on vaccinations?
Really encourage, at least from my perspective, really encourage people to make sure that they have any replacement heifers, that kind of thing, well vaccinated before you even think about starting to get them bred. Right?
You bet.
And I lean a little bit more towards using modified lives, but that doesn't mean you can't use a modified live program, and then as your management scheme changes, shift to a killed product. So.
I'm seeing quite a bit of that in using a modified live in our replacement heifers, and then once we're doing that booster with the bred, the people are switching to the killed
vaccines,
in the bred cows. And again, that's if you want to enlist a fight at a veterinary meeting, say it's kind of like the Miller Lite tastes great, less filling. If you just say
right.
modified live or killed, and the room automatically divides,
it will split right down the middle,
and the fight ensues. So work with your local veterinarian and that knows the cows, knows the geography, knows the sale barns, knows the systems.
Knows your management system. Yeah, absolutely.
So many different.
Because nothing is one size fits all.
Right.
Whether it's diagnostic testing or whether it's your vaccine program or whether it's your biosecurity program. So.
Yeah, and so, but the big thing is that I think you drove home is have a plan.
Have a plan.
Don't do the testing You know, Dad always said that it was easier to sell a vaccine for a few $1,000s than to sell a diagnosis for a few dollars.
That is true.
And,
that is true.
And this one is one of those, as you list, it takes a plan.
It takes a plan
the
to be in
vaccination.
place. Yeah, because like I said, if you don't have a plan, you probably are wasting your diagnostic dollars.
Perfect. Let's take a break. When we come back, we'll do a wrap-up with Dr. Vickie Cooper here at Iowa State University on bovine viral diarrhea.
Join us for the 15th annual Fall Bull Sale at Gardner Angus Ranch, Monday, September 30th at 9 a.m., featuring approximately 450 registered bulls, 160 registered females, including 35 cows and 125 heifers, and 300 bred commercial females. These are elite herd sire prospects and rank in the top percentiles of the Angus breed for calving ease, growth, and end-product merit. Catalog will be available at GardnerAngus.com. Register for online bidding at liveauction.tv. It's business as usual, producing value-added seed stock that provides opportunities for profitability regardless of our customers' chosen marketing endpoint. See you in September at the ranch.
I had this horse. It was a good horse, except for when the wind was blowing above 30 miles an hour. Wind was blowing about 35, 40, and I saddled him up, rode him out to the end of the lane, and I thought, well, he's doing pretty good. And about 6 jumps later, I was laying on the ground and thinking, boy, my shoulders sure hurt. I kept waiting, and it didn't get better, and so I went to an orthopedic surgeon, and that showed that I had torn rotator cuff. He said, well, we'll have to do surgery. I thought, I farm and ranch by myself. This is not going to work out very well. I'd been sleeping in my recliner for about 2.5 years because it hurt too much to sleep in bed on my side. I'd heard about Kansas Regenerative Medicine Center on the radio. Gotten down there at 8 o'clock in the morning, and by 11:30 the procedure was all over. They just took some fat out of my side here and spun that down for about 45 minutes and then injected it in my shoulders, and I was on my way. It's something you don't hear about, but I thought it was worth a try, and I'm really pleased. It's really worked out well for me.
Kim Mannering with Hardy Insurance. Today we will talk about umbrella coverage. Did you know that if you're held liable in any type of accident, the judgment can claim your assets? Please give me a call so we can discuss. 316-945-6733.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Vickie Cooper at Iowa State University's College of Veterinary Medicine, talking about bovine viral diarrhea, otherwise known as BVD. And so, you know, we talked about how it happens and what it can affect, and diagnostic testing and vaccination, but how prevalent? I mean, tell me what you've been seeing over the years of studying this. Are we more or less?
So over the last 10 years of running quite a few diagnostic tests here at Iowa State University, we've really not seen the prevalence shift a lot when you average it out over time. So it stays about 0.15% of the population, which doesn't really sound like very much. But what we do see is producers that will have clusters of cases. So you have a producer that perhaps has 30 cows or so, they may end up having 6 head of persistently infected calves. Right, yeah. And that's a huge economic insult to somebody that has 30 head of cows.
Absolutely.
Right? And so that's how typically in the beef industry it tends to shake out, right? We'll have producers that have clusters of calves. As they test and initiate vaccination programs, biosecurity programs, maybe the next year they'll just have 1 persistently infected calf. But typically they'll clear up their herd fairly quickly. That's why they'll continue to test, and so the overall prevalence looks very low because most herds will continue to test over time after they've had a cluster of persistently
Yeah,
infected
we're not going to
calves.
have that happen again.
Right,
we're
exactly.
going to stay on top of it and probably err to the side of
probably over-testing to some degree.
Right. You know, when we see those clusters, is it usually, you know, something triggered people to do the testing to begin with, like a bunch of open cows
or they've got
scouring calves?
Calves out on pasture and they lose one, call their veterinarian to come out and do a post-mortem examination. They send in tissues and lo and behold, we find that the calf's BVD positive, right? And then it's like, oh, well, we better start taking a look.
What are some of the, ethics around BVD?
That's the hard part, right? Because typically we recommend that if a calf is persistently infected, that either you quarantine it and feed it out yourself, or you humanely euthanize it. It's obviously not very ethical to run it through the sale bar and make it someone else's problem.
Right. And you know, I know you saw this, but even Texas is even looking at making BVD a reportable disease.
Yes, they are, and it's going to be interesting to see what happens with that. Because I have a feeling that if they make it a reportable disease, yet there's no program in place to compensate producers that find it in their herds, they'll probably just see a cessation of testing.
Right. Yeah, we just won't.
We won't look. We won't look, so we don't know.
That's right. Well, thank you so much for being on the show. And thanks for all you do for us in the beef industry and in the veterinary profession. We're very thankful.
Thank you.
Thanks. And thanks for watching DocTalk here from Iowa State University. Remember, always work with your local veterinarian. And if you want to know more about what we do on DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson with Dr. Vickie Cooper. We'll see you down the road.
Closed captioning brought to you by VetGun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by Merck Animal Health, the science of healthier animals.
What if sustainability were synonymous with U.S. soy? If energy efficiency, water quality, and soil health help define U.S. soy's value, that future is here, the time is now. To meet end-user demands, the Soybean Checkoff is committing to sustainability that's achievable, worthwhile, and enduring. A message from the Kansas Soybean Commission, the Soybean Checkoff, progress powered by Kansas farmers.
Join us for the 15th annual Fall Bull Sale at Gardner Angus Ranch, Monday, September 30th at 9 a.m., featuring approximately 450 registered bulls, 160 registered females, including 35 cows and 125 heifers, and 300 bred commercial females. These are elite herd sire prospects and rank in the top percentiles of the Angus breed for calving ease, growth, and in-product merit. Catalog will be available at GardnerAngus.com. Register for online bidding at liveauction.tv. It's business as usual, producing value-added seed stock that provides opportunities for profitability regardless of our customers' chosen marketing endpoint. See you in September at the ranch.